The following instructions are important after an exposure and bonding procedure. After your surgery, do not disturb the surgical site or the packing that is placed inside your mouth. This packing is in place to keep the tooth exposed. Do not be alarmed if this packing falls out or moves from its original positioning. If a small gold chain was placed attached to the impacted tooth, it is essential that your orthodontist activates the chain as soon as possible or per their instructions following surgery. If this chain becomes dislodged from the tooth, please contact our office immediately to have the chain replaced. A small amount of bleeding is common for the first few days. Place a gauze pad directly over the surgical site and hold it in place with firm biting pressure for around 30 to 45 minutes or until the bleeding can be controlled. Replace the gauze pads every 30 to 45 minutes. The amount of bleeding will vary from person to person. The gauze pads will always appear red. The way to assess bleeding is to directly look at the sites after the gauze pads are removed. If the bleeding does not slow down, please call our office. Swelling can be normal after surgery. Keep your head elevated with 1 to 2 pillows for the first 3 to 4 days. Do not lie flat. Swelling can be reduced by applying an ice pack to the side of your face for 20 minutes on and 20 minutes off. Continue icing the face as much as possible for the first 24 to 36 hours. Do not apply ice directly to the skin. These measures may not eliminate swelling, but they will help reduce its severity. Pudding, jello, applesauce, yogurt, ice cream, and smoothies are excellent options for the day of the procedure. Always cool down any hot foods or liquids during the first 24 hours. You should eat only soft foods for the first week, like scrambled eggs, mashed potatoes, macaroni and cheese, soft fish, and steamed vegetables. Do not use a straw or spit for the first week after the surgery. Avoid hard, crunchy, or very chewy foods until the site is fully healed and you are pain-free. Pain medication may be prescribed, and it is advised that you take a pain medication on the first day. If you are not allergic or intolerant to non-steroidal anti-inflammatory drugs, you may start taking Advil or Motrin. If Advil or Motrin doesn't control your discomfort, take the prescribed narcotic in addition. It is recommended that you alternate between the narcotic and Advil or Motrin. Do not take them at the same time. Be certain to take your pain medication with food, as this will help prevent an upset stomach. Remember, narcotic pain medication will impair your judgment and reflexes, so do not drive or operate heavy machinery. Typically, minors will not be prescribed narcotics, as over-the-counter pain medications are effective for these procedures. Begin brushing your teeth on the day of surgery. It is important to brush all of your teeth, even if the teeth and gums are sensitive. Please avoid the surgical site on the day of the procedure. On the next day, gently brush over the surgical sites with almost no pressure. You may remove some stitches, which is fine. Brush around the packing if one has been placed. It is important to keep the areas really clean to avoid infection or delayed healing. Thank you for taking the time to watch these post-operative instructions and following them carefully.